Hi, my name is Victoria Sutton and I'm the Director of the Senior Division at SBH. Over the last few days, I've been getting a lot of questions about how we can be helping our community seniors through this coronavirus crisis, and I wanted to share with you a few tips that could hopefully help you and your family. As we know, seniors are being affected much more than the general population. It's much more dangerous if they get infected. So here are a few tools that hopefully you can use to help make the right decisions when it comes to you and your family. One question I've been asked a lot is, should young children be visiting the seniors in their life or their grandparents? The easiest answer is no. We know that children are carriers for coronavirus and we might not see any outward symptoms. So they may want to play with friends and be feeling fine, but if they get close to a grandparent, a senior, it could really have adverse effects on that senior's health. So we really should be mindful and limit how much exposure children are having to senior citizens in our community. The best thing to do in lieu of that is FaceTiming and phone calls rather than in-person visits. The other question that I've been getting a lot is what to do about home health aides, nurses who are living with our seniors and living with them in the home. One thing that should be considered is if there's a child who could take over some of these responsibilities, limiting what other people come into the house, that's preferable. Of course, I understand that that isn't always possible, but it's something to consider. Aside from that, sometimes people have a few aides splitting the week. So let's say you'll have one aide for 3 days, one aide for 4 days. If it's possible to have the same consistent help, over the week, over the next few weeks, that would certainly be preferable because it's one stranger coming in, as opposed to a few. The other thing is if there's really nothing that can be done and you have a few aides coming in or a few nurses, sit down with them, tell them about any of your fears and hesitations, and make sure they know to be following the CDC's guidelines. The CDC recommends wearing gloves and masks when applicable, washing hands, and don't assume that because they're home health aides and because they're professionals, they know. Sit them down, tell them what you're expected, and make sure that they're adhering to these regulations. Please feel free to reach out to me or my team if you have any questions. We're here to help.